The W-sit reflects the ability to tolerate deep levels of hip internal rotation, and to most stiff adults with less than favorable hip anatomy, it'll feel just downright impossible. But it can be achieved with the right training process and respect for your anatomy. Oftentimes, you'll see people showcasing this with posterior pelvic tilt, which actually removes the hip flexion demand, making it much easier to reach the ground. However, training it like this tends to be more stressful on the knees as it places more load through tibial external rotation and less in the hips. I believe for the W sit to have some carryover into squat depth or improving hip flexion, it should be trained with an anterior pelvic tilt. An anterior tilt increases the coverage of the acetabular rim over the femur, which will take up all the slack in the joint and make the position much more challenging, but it'll take stress off the knees. This will be uncomfortable on the hips, but over time you'll adapt. I also see people starting with their feet outside the knees, which already maxes out the internal rotation of the hip and doesn't leave the pelvis any room to shift back into. Now, most open chain drills or static passive stretches are good for general hip health, but I've never found them to have any carryover into achieving the full W sit, as this requires more specific form of loading. Instead, we can use drills where we mimic a W sit on one side, which will be much less apprehensive, and we can focus on maintaining an anterior tilt while strengthening the hip rotators dynamically. But once these are comfortable, the W sit itself should be the bread and butter. The best combo I've found is dynamic reps using a target to reach each rep and finishing with loaded yielding isometrics. A little bit of rounding under at the bottom is fine as long as you initiate with the anterior tilt. Quick disclaimer, if you have hip pain or have had it in the past, be very careful with your dosing and progression toward this, making sure not to train it over twice a week. In fact, some of the best progress I've made while working toward the W sit was only training it once a week for 2 total working sets. I'd also recommend putting your other intense flexibility work to the side, such as training for the splits, because that's a lot of stress on the capsule and you could risk getting a flare-up, as connective tissue injuries tend to creep up on you quickly. So less is more with this one. Train it intensely and recover.